3. Points. Brief introduction. In November of 1989, the World Health Organization adopted the international standard for the names of 409 points in the 14 meridians and extra points after discussions and consideration. In June 1990, the State Supervision Bureau of Technology issued the state standard for the location of acupuncture points, 409 in number, which has been implemented since January 1st, 1991. Due to limited space and time, 152 commonly used points are selected and introduced in parts 3, 4, and 5. Definition. Points are curative sites on the body for Genjo therapies. Points are mostly located in tendons, bones, and muscles pertaining to the 11 meridians respectively. Function. Points can be used to treat diseases and keep good health by removing obstruction in the meridian's collaterals, regulating qi and blood, reinforcing the deficiency, and reducing the excess. They function in treating local, remote, and general disorders of the body. Local functions. Each point has its local function. For instance, points on the eye region can be used to treat eye diseases. Points on the ear region can be used to treat ear diseases. Points on the abdominal region can be used to treat diseases of internal organs. Remote functions. Besides the local functions, many points have the remote functions. For example, Neiguan, pericardium 6 on the forearm, can be used to treat disorders of the chest, heart, and stomach. Zusanli, stomach 36, on the lower part of the leg, can be punctured to treat disorders of the abdomen. General functions. Besides the two above mentioned functions, some other points have the function for treating system disorders. For instance, Da Zui, Du 14, can be punctured to treat common cold and fever. Measurement. Each point has its own size and depth in different locations. A point covers an area of about 0.1 cun multiplied by 0.1 multiplied by 3.1416 cun. The depth of insertion varies between 0.1 cun and 2.5 cun. Points on areas where muscle is thin are shallow, while those on areas where muscle is thick are deep. Classification. Points can be classified into 3 categories. They are points of the 14 meridians, extra points, and Ashi points. 1. Points of the 14 meridians. Points of the Ren meridian. Points of the Du meridian. Points of the 3 yin meridians of the hand. Points of the 3 yang meridians of the hand. points of the 3 yang meridians of the foot. Points of the 3 yin meridians of the foot. Extra points. All points other than the points of the 14 meridians. 3. Shi points. They are also called Tian Ying points or non-fixed points. 2. Classification according to the nature of points. Points can be classified into 5 shu points, Luo Xue connecting points, Si Xue cleft points, back shu points, front mu points, the 8 influential points, and the 8 confluent points. 1. 5 shu points. Jing Xue well points. Shangyang, large intestine 1, Yin Bai, spleen 1. Yin Xue spleen points. Arjian, large intestine 2, Dadu, spleen 2. Shu Xue stream points. Tai Bai, spleen 3. Yuan Xue source points. Hegu, large intestine 4. Jin Xue river points. Yangxi, large intestine 5. Ha Xue sea point. Quqi, large intestine 11. 2. Luo Xue connecting points. Li Que, lung 7. 3. Si Xue cleft point. Keng Zui, lung 6. 4. Back shu point. Fei Shu, bladder 13, Xin Shu, bladder 15. 5. Mu Xue front mu point. Zhong Fu, lung 1, Ju Que, ren 14. 6. The 8 influential points of Zhang, Fu, Qi, blood, vessels, tendon, bone, and marrow. 7. The 8 confluent points. Meiguan, pericardium 6, Gongsun, spleen 4. 3. Classification according to the locations of points. According to the locations of points, there are points on the head and neck, points on the abdomen and chest, points on the back and lower back, and points on the upper and lower limbs. Methods of locating points. There are methods of locating points: anatomical landmarks, proportional measurement, and finger measurement. 1. Anatomical landmarks. Points are located according to the hairline, spinous process of the vertebrae, nipples, umbilicus, and so on. 2. Proportional measurement. The distance between the distal end of the auxiliary fold of the transverse cubital crease is 9 cun. The distance between the transverse cubital crease and the transverse wrist crease is 12 cun. Finger measurement. There are middle finger measurement, thumb measurement, and four-finger measurement. Points of Ren Meridian. There are altogether 24 points in the Ren Meridian, which are located on the midline of the face, neck, chest, and abdomen. The commonly used 10 points among the 24 are selected and introduced. Transverse measurement on the chest and abdomen. The distance between the two nipples is 8 cun. Longitudinal measurement on the chest. Points are located according to the intercostal space. Longitudinal measurement on the abdomen. The distance from the sternocostal angle to the umbilicus is 8 cun. The distance from the umbilicus to the center of the upper border of symphysis pubis is 5 cun. The first point is Huiyin, Ren 1, and the last is Chengjiang, Ren 24. Zhongji, Ren 3, on the anterior midline of the abdomen, 4 cun below the umbilicus, front mu point of the urinary bladder. Indications: enuresis, nocturnal emission, impotence, irregular menstruation, dysmenorrhea, uterine bleeding. Puncture half cun to 1 cun. Apply 5 to 10 moxicons for 10 to 30 minutes, moxibustion. Guanyuan, Ren 4. On the anterior midline of the abdomen, 3 cun below the umbilicus. Front mu point of the small intestine. Indications: enuresis, nocturnal emission, impotence, irregular menstruation, uterine bleeding, dysentery, diarrhea, windstroke, dizziness, B syndromes, diabetes, and facial beautification. Caution puncture 0.5 to 1.2 cun. Apply 3 to 7 moxicones or 10 to 30 minutes moxibustion. Qihai, Ren 6. On the anterior midline of the abdomen, 1.5 cun below the umbilicus. Indications: abdominal pain, enuresis, nocturnal emission, impotence, edema, diarrhea, constipation, irregular menstruation, uterine bleeding, palpitation, asthma, gastritosis, diabetes, intestinal abscess, hemorrhoids. Puncture 0.5 to 1 cun. Apply 5 to 10 pieces of moxicone or 10 to 30 minutes moxibustion. Shenque, Ren 8. In the center of the umbilicus. Indications: abdominal pain, diarrhea, constipation, edema, flaccid type of windstroke, hemorrhoids, urticaria. Puncture is contraindicated. Apply 3 to 5 moxicones or 10 to 30 minutes moxibustion. Zhengwan, Ren 12. On the anterior midline of the abdomen, 4 cun above the umbilicus. Front mu point of the stomach. Influential point of the full organs. Indications: abdominal pain and distension, vomiting, diarrhea, constipation, epigastric pain. Puncture half to 1 cun. Apply 5 to 10 moxicones or 10 to 30 minutes moxibustion. Juque, Ren 14. On the anterior midline of the abdomen, 6 cun above the umbilicus, front mu point of the heart. Indications: chest pain, palpitation, vomiting, diarrhea, epilepsy. Puncture 0.4 to 0.8 cun. Apply 5 to 10 moxicons or 10 to 30 minutes moxibustion. Tanzong, Ren 17. On the anterior midline of the chest, at the level with the fourth intercostal space, midway between the nipples. Front mu point of the pericardium, influential point of qi. Indications: asthma, chest pains, palpitation, insufficient lactation, difficulty in swallowing, hiccups. Puncture 0.3 to 0.5 cun subcutaneously with downward direction of the needle tip. Apply 5 to 7 moxicons or 10 to 20 minutes moxibustion. Tiantu, Ren 22. On the anterior midline of the neck, in the center of the suprasternal fossa. Indications: asthma, cough, sore throat, dry throat, sudden vocal hoarseness. Puncture 0.3 to 0.5 cun with downward direction of the needle tip. No perpendicular insertion. Apply 3 to 5 moxicons or 5 to 20 minutes moxibustion. Lianquan, Ren 23. On the anterior midline of the neck, above the Adam's apple, in the depression of the upper border of the hyoid bone. Indications: aphasia by windstroke, salivation. Puncture 0.3 to 0.5 cun obliquely upward. Apply 2 to 3 moxicons or 5 to 20 minutes moxibustion. Chengjiang, Ren 24. In the facial region, in the depression of the center of the mentolabial groove. Indications: swelling pain of the gums, distortion of the eyes and mouth, salivation, drug addiction. Puncture 0.2 to 0.3 cun. Apply 3 to 5 moxicons or 5 to 20 minutes moxibustion. Points of due meridian. Anatomical landmarks. Philtrium, the tip of the nose. The midpoint between the eyebrows. The anterior hairline. The posterior hairline. The first thoracic vertebrae to the fifth lumbar vertebrae. There are altogether 28 points in the due meridian, which are located on the posterior midline of the head, face, nape, back, lumbar, and sacral regions. The first point is Changqiang, due 1. The last point, Yinjiao, due 28. 9 commonly used points are introduced here. Changqiang, due 1. 0.5 cun below the tip of the coccyx, midway between the tip of the coccyx and the anus. Indications: pain in the lumbar or sacral regions, hemorrhoids, epilepsy. Puncture 0.3 to 0.5 cun being parallel to the sacrum with an upward direction of the needle tip, or apply 10 to 30 minutes moxibustion. Yaoyangguan, due 3. On the posterior midline of the lumbar region, in the depression below the spinous process of the fourth lumbar vertebrae. Indications: pain in the lumbar or sacral regions, B syndromes of the lower limbs. Puncture 0.3 to 0.5 cun Apply 3 to 7 moxicons or 10 to 30 minutes moxibustion. Mingmen, do 4. On the posterior midline of the lumbar region, in the depression below the spinous process of the second lumbar vertebrae. Indications: lumbago, pain in the lumbar vertebrae, impotence, nocturnal emission, irregular menstruation, diarrhea. Puncture 0.3 to 0.5 Cun. Apply 3 to 7 moxicons or 10 to 30 minutes moxibustion. Zhiyang, do 9. On the posterior midline of the back, in the depression below the spinous process of the 7th thoracic vertebrae, approximately at the level of the inferior angle of the scapula. Indications: chest pains, back pains, malaria, cough, asthma. Puncture 0.3 to 0.5 Cun. Apply 3 to 7 moxicons or 10 to 20 minutes moxibustion. Dazui, do 14. On the posterior midline of the back, in the depression above the spinous process of the first thoracic vertebrae. Indications: neck pain and stiffness, lumbago, malaria, afternoon fever, cough, asthma, common cold, urticaria. Puncture 0.5 to 1 Cun. Apply 3 to 7 moxicons and 10 to 30 minutes moxibustion. Feng Fu, do 16. On the nape, 1 Cun right above the midpoint of the posterior hairline, right below the external occipital protuberance, in the depression between muscle trapezius of both sides. Indications: headache, neck stiffness, blurring of vision, epistaxis, sore throat, aphasia, and mental disorders. Puncture 0.3 to 0.5 Cun. Apply 3 to 5 moxicons or 10 to 20 minutes moxibustion. Bai Hui, do 20. On the midline of the head, 5 Cun right above the midpoint of the anterior hairline, midway of the line connecting the two ear apexes. Indications: headache, dizziness, tinnitus, hemiplegia, prolapse of the rectum, epilepsy. Puncture 0.2 to 0.3 Cun. Apply 3 to 5 moxicons or 5 to 10 minutes moxibustion. Shangxing, do 23. 1 Cun right above the midpoint of the anterior hairline. Indications: headache, nasal obstruction, epistaxis, facial beautification. Puncture 0.2 to 0.3 Cun or prick to cause bleeding. Apply 3 to 5 moxicons or 5 to 10 minutes moxibustion. Shuigou or Renzong, do 26. On the philtrum, on the point of where the upper 1/3 and middle 1/3 and the lower portion meet. Indications: coma, distortion of the mouth and eyes, diabetes, puffiness of the face, pain and stiffness of the lower back, hysteria. Puncture 0.2 to 0.3 Cun obliquely upward. Points of lung meridian of hand Tai-yin. Method of locating the points on the arm and the palmar aspect of the forearm. The distance between the end of the axillary fold and transverse cubital crease is 9 Cun. The distance between the transverse cubital crease and the transverse wrist crease is 12 Cun. The first point is Zongfu, Lung 1. Last point of Shaoshang, long 11. 7 points are selected and introduced. Zhongfu, long 1. Lateral superior to the sternum, 1 cun below Yunmen, long 2, at the same level with the first intercostal space, 6 cun lateral to the rim meridian. It's the front mu point of the lung meridian. Indications, cough and asthma. Puncture 0.3 to 0.5 cun, apply 3 to 5 moxicons or 10 to 20 minutes moxibustion. Shizi, long 5. On the end of the radial aspect of the cubital crease, on the radial side of the tendon attachment of biceps. Hesi point of the lung meridian. Indications, cough, asthma, fullness and distension in the chest and hypochondriac region, acute vomiting and diarrhea, sore throat. Puncture 0.3 to 0.5 cun, apply 3 to 5 moxicons or 5 to 10 minutes moxibustion. Kongzui, long 6. On the radial aspect of the palmar side of the forearm, 5 cun below Chizi, long 5, or 7 cun above Taiyuan, long 9. It's C-cleft point of the lung meridian. Indications, chest pain, cough, asthma, hemoptysis, sore throat. Puncture 0.5 to 1 cun, apply 3 to 5 moxicons or 5 to 10 minutes moxibustion. Liechue, long 7. On the border of the radial aspect of the forearm, 1.5 cun obliquely above Taiyuan, long 9. It's lower connecting point of the lung meridian. Indications, headaches, stiffness of the neck, migraines, cough, asthma, sore throat, distortions of eye and mouth, wrist pain, and drug addiction. Puncture 0.3 to 0.5 cun, apply 3 to 5 moxicons or 5 to 10 minutes moxibustion. Taiyuan, long 9. On the midpoint of the distal 1/3 of the radial aspect of the transverse crease of the wrist on the palmar side, in the place where the radial artery throbs. Shoestring point of the lung meridian. Indications, chest pain, cough, asthma, hemoptysis, sore throat, Halsness syndrome, wrist pain. Puncture 0.2 to 0.3 cun, apply 3 to 5 moxicons or 5 to 10 minutes moxibustion. Yuji, long 10. On the radial aspect of the midpoint of the first metacarpal bone, on the line between the palm and the back of the hand. Indications, common cold, fever, headaches, cough, asthma, hemoptysis, and sore throat. Puncture 0.5 to 0.8 cun, apply 3 to 5 moxicons or 5 to 10 minutes moxibustion. Shaoshang, long 11. On the radial side of the thumb, about 0.1 cun posterior to the corner of the nail, Jingwell point of the lung meridian. Indications, shock, loss of consciousness, coma, fever, cough, asthma, sore throat, and mania. Puncture 0.1 cun or prick the point to deplete blood. Points of heart meridian of hand Shaoyin. There are 9 points on each side of this meridian. There are 18 points on both sides. They are located in the auxiliary region on the palmar aspect of the ulnar side. The first point is Jiquan, heart 1, and the last one, Shaochong, heart 9. 4 points will be selected and introduced. Shaohai, heart 3. With the arm flexed at the midpoint of the line connecting the medial end of the cubital crease and the medial epicondyle of humerus. It is the 合穴 C point of the heart meridian. Indications: cardiac pain and numbness of the hand. Puncture 0.3 to 0.5 Cun or apply 10 to 20 minutes moxibustion. Tongli, heart 5. On the palmar side of the forearm and on the radial side of the ulnar flexor muscle of the wrist, 1 Cun proximal to Shenmen, heart 7. It is the Luoxue connecting point of the heart meridian. Indications: palpitation, dizziness, blurring of vision, aphasia with stiffness of the tongue. Puncture 0.3 to 0.5 Cun. Apply 2 to 3 moxicones or 10 to 20 minutes moxibustion. Shenmen, heart 7. On the wrist, at the midpoint of the 1/3 from the ulnar side of the transverse crease, in the depression on the radial side of the tendon of flexor carpi ulnaris. It is Shuxue stream point and Yuanxue source point of the heart meridian. Indications: cardiac pain, palpitation, insomnia, and mania. Puncture 0.2 to 0.4 Cun, apply 2 to 3 moxicones, or 10 to 20 minutes moxibustion. Shaochong, heart 9. On the radial side of the little finger, about 0.1 Cun posterior to the corner of the nail. It is the Jingxue well point of the heart meridian. Indications: windstroke, syncope, febrile diseases, cardiac pain. Puncture 0.1 to 0.2 Cun, apply 2 to 3 moxicones, or prick with a 3-edged needle to bleed. Points of pericardium meridian of hand Jieyin. There are 9 points on each side, altogether 18 points on both sides. They are located in the chest and on the midline of the palmar side of the arm. The first point is Tianshi, pericardium 1, and the last one is Zhongcheng, pericardium 9. 6 points are selected and introduced. Quzi, pericardium 3. On the midpoint of the transverse cubital crease, at the ulnar side of the tendon of muscle biceps bronchi. It is the 合穴 C point of the pericardium meridian. Indications: cardiac pain, palpitation, irritability, thirst, acute vomiting, and diarrhea. Puncture 0.5 to 1 Cun, apply 3 to 5 moxicones, or 5 to 10 minutes moxibustion. Ximen, pericardium 4. On the middle of the palmar side of the forearm, 5 Cun above Daling, pericardium 7. See cleft point of the pericardium meridian. Indications: cardiac pain, chest pain, palpitation, and boils. Puncture 0.5 to 1 Cun, apply 3 to 5 moxicones, or 5 to 10 minutes moxibustion. Jianshi, pericardium 5. On the midline of the palmar side of the forearm, 3 Cun above Daling, pericardium 7, between the tendons of muscle palmaris longus and flexor carpi radialis. It is the Jing river point of the pericardium meridian. Indications: cardiac pain, stomachache, vomiting, mental disorders, epilepsy. Puncture 0.5 to 0.3 Cun, apply 3 to 5 moxicones, or 10 to 20 minutes moxibustion. Niguan, pericardium 6. On the midline of the palmar side of the forearm, 2 Cun above Daling, pericardium 7, between the tendons of muscle palmaris longus and muscle flexor radialis. It's the Luo connecting point of the pericardium meridian and one of the 8 confluent points. Indications: cardiac pain, palpitation, chest stuffiness, stomachache, nausea, vomiting, hiccup, mental disorders, and epilepsy. Puncture 0.5 to 1 cun, apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. Daling, pericardium 7. In the middle of the transverse crease of the wrist, between the tendons of muscle palmaris longus and muscle flexor carpi radialis. Shu stream and yuan source point of the pericardium meridian. Indications: fever, headache, cardiac pain, palpitation, mental disorders, epilepsy, and insomnia. Puncture 0.3 to 0.5 cun, apply 3 to 5 moxicons, or 5 to 10 minutes moxibustion. Zhongchong, pericardium 9. In the center of the tip of the middle finger, it's the Jing well point of the pericardium meridian. Indications: wind stroke, coma, loss of consciousness, and convulsion. Puncture 0.1 cun, or prick to bleed with a 3-edged needle. Points of large intestine meridian of hand Yangming. There are 20 points on this meridian on each side, altogether 40 points on both sides. They are located on the radial side of the posterior aspect of the upper limbs, the neck, and the facial region. The first point is Xiangyang, large intestine 1, and the last one, Inxiang, large intestine 20. 8 points are selected and introduced. Shanyang, large intestine 1. On the radial side of the index finger, about 0.1 cun posterior to the corner of the nail. It is the Jing well point of the large intestine meridian. Indications: strokes, loss of consciousness, toothache, sore throat, numbness of fingers. Puncture 0.1 cun or prick to bleed. Hegu, large intestine 4. On the dorsum of the hand, between the first and second metacarpal bones, approximately in the middle of the second metacarpal bone on the radial side. Yuan source point of the large intestine meridian. Indications: headache, neck pain, redness, swelling and pain of the eyes, toothache, sore throat, nasal obstruction, epistaxis, facial paralysis, febrile disease with anhidrosis, hydrosis, dysmenorrhea, hemiplegia, constipation, diarrhea, common cold, cough, hysteria, obesity, and drug and tobacco addiction. Puncture 0.6 to 1 cun, apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. Yangxi, large intestine 5. On the radial side of the wrist. When the thumb is tilted upward, it is in the depression between the tendons of muscle, extensor pollicis, longus and brevis. It is the Jingxue river point of the large intestine meridian. Indications: headache, redness, pain and swelling of the eyes, sore throat, wrist sprains. Puncture 0.3 to 0.5 cun, apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. Pianmi, large intestine 6. On the radial side of the palmar aspect of the forearm, on the midpoint of the lower 1/2 of the line connecting Yangxi, large intestine 5, and Quqi, large intestine 11, 3 cun above Yangxi, large intestine 5. It's the lower connecting point of the large intestine meridian. Indications: wrist and forearm pains, eye diseases, epistaxis, and sore throat. Puncture 0.3 to 0.5 cun, apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. Quqi, large intestine 11. On the radial side of the transverse crease of the elbow, on the midpoint between Qizi, lung 5, and the lateral epicondyle of the humerus. Locate the point with the arm flexed at a 90-degree angle. It is the He point on the large intestine meridian. Indications: headache, dizziness, redness, swelling, and pain of the eyes, sore throat, motor impairment of the upper limbs, abdominal pain, vomiting, diarrhea, urticaria, frozen shoulder, hysteria, constipation, common cold of infantile paralysis, obesity, and facial beautification. Puncture 1 to 1.5 twin, apply 3 to 7 moxicons, or 10 to 30 minutes moxibustion. Jianyu, large intestine 15. On the shoulder, when the arm is in full abduction or raised to the front horizontally, in the depression between the humerus bone and to the acromion. Indications: hemiplegia caused by strokes, soreness and shoulder and arm pains, frozen shoulder, articardia, B syndromes, and shoulder sprain. Puncture 0.5 to 1 twin, apply 3 to 7 moxicons, or 10 to 20 minutes moxibustion. Futu, large intestine 18. On the lateral sides of the neck, at the level of the Adam's apple, between the anterior and posterior border of muscle, sternocleidomastoides. Indications: cough, asthma, sore throat, sudden vocal hoarseness, scrofula goiter. Puncture 0.3 to 0.5 twin, apply 3 to 5 moxicons, or 5 to 10 minutes moxibustion. Yingxiang, large intestine 20. In the nasolabial groove, at the level of the midpoint of the lateral border of ala nasi. Indications: running nose and nasal obstruction, epistaxy, rhinorrhea, swelling and pain of the face. Puncture 0.2 to 0.3 twin obliquely upward, 0.5 to 1 twin. Points of small intestine meridian and hand, taiyang. There are 19 points on each side in the meridian, altogether 38 points on both sides. They are located on the posterior side of the ulnar side, shoulder, neck, and face. The first point is Shaozi, small intestine 1, and the last one is Tingong, small intestine 19. 8 points are selected and introduced. Shaozi, small intestine 1. On the ulnar side of the little finger, about 0.1 twin posterior to the corner of the nail. It is the Jingxue well point of the small intestine meridian. Indications: febrile diseases, loss of consciousness, sore throat, and insufficient lactation. Puncture 0.1 twin or prick with a 3-edged needle to bleed, or apply 5 to 10 minutes moxibustion. Houxi, small intestine 3. When a loose fist is made, the point is on the ulnar side, proximal to the 5th metacarpophalangeal joint, at the end of the transverse crease and on the line between the red and white skin. It is the Shuxue strain point of the small intestine meridian and one of the 8 confluent points. Indications: pain and stiffness of the neck, tinnitus, deafness, sore throat, mania, malaria. Puncture 0.5 to 1 twin, apply 3 to 5 moxicons, or 5 to 10 minutes moxibustion. Wangu, small intestine 4. On the ulnar side of the palm, in the depression between the base of the 5th metacarpal bone and the triquetral bone, on the junction of the red and white skin. It is the yuan source point of the small intestine meridian. Indications: headache and stiffness of the neck. Puncture 0.3 to 0.5 twin, apply 3 to 5 moxicons, or 10 to 30 minutes moxibustion. Yangu, small intestine 5. At the ulnar end of the transverse crease on the dorsal aspect of the wrist, in the depression between the styloid process of the ulna and the triquetral bone, it is the Jinxue river point on the small intestine meridian. Indications: febrile disease, pain in the neck and submandibular region. Puncture 0.2 to 0.3 Cun, apply 2 to 3 moxicons, or 10 to 20 minutes moxibustion. Zhizheng, small intestine 7. On the ulnar side of the dorsal aspect of the forearm, on the line connecting Yanggu, small intestine 5, and Xiaohai, small intestine 8, 5 Cun above Yanggu, small intestine 5. It is the Luoxue connecting point of the small intestine meridian. Indications: headache, pain in the hypochondriac regions, and mania. Puncture 0.3 to 0.5 Cun, apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. Xiaohai, small intestine 8. At the medial side of the elbow, in the depression between the olecranon of the ulna and the medial epicondyle of the humerus. It is the Hexue C point of the small intestine meridian. Indications: headache, neck stiffness, pain in the shoulder, arm, and elbow. Puncture 0.2 to 0.4 Cun, apply 2 to 3 moxicons, or 5 to 10 minutes moxibustion. Tianzong, small intestine 11. On the scapula, in the depression of the center of the subscapular fossa, and on the level of the 4th thoracic vertebra. Indications: soreness and pain in the scapula. Puncture 0.5 to 0.8 Cun, apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. Tingong, small intestine 19. In the facial region, anterior to the tragus and posterior to the condyloid process of the mandible, in the depression formed when the mouth is open. Indications: tinnitus and deafness. Puncture 0.5 to 1 Cun, apply 2 to 3 moxicons, or 5 to 10 minutes moxibustion. Points of Sanjiao meridian of hand, Shaoyang. There are 23 points in Sanjiao meridian, which are located on the posterior aspect of the upper limbs, neck region, and lateral aspect of the head. The first point is Guanchong, Sanjiao 1, and the last one is Sizhukong, Sanjiao 23. 8 commonly used points are selected and introduced. Zhongzhu, Sanjiao 3. On the dorsum of the hand, posterior to the 4th metacarpophalangeal joint, in the depression of the anterior and between the 4th and 5th metacarpal bones. It is a Shuxue stream point on the Sanjiao meridian. Indications: headache, deafness and tinnitus, and motor impairment of fingers. Puncture 0.3 to 0.5 Cun, apply 3 to 5 moxicons, or 5 to 10 minutes moxibustion. Yangchi, Sanjiao 4. On the transverse crease of the dorsum of the wrist, in the depression of the border of the ulnar aspect of the tendon of muscle, extensor digitorum communis, it's the Yuan source point of the Sanjiao meridian. Indications: pain in shoulder, arm, and wrist. Puncture 0.3 to 0.5 Cun, apply 3 to 5 moxicons, or 5 to 10 minutes moxibustion. Waiguan, Sanjiao 5. On the midline of the posterior aspect of the forearm, 2 Cun above the midpoint of the transverse crease of the dorsum of the wrist, between the radius and ulna. It's the Luo connecting point on the Sanjiao meridian, one of the 8 confluent points. Indications: headache, cough, strained neck, deafness, tinnitus, chest, and hypochondriac pains. Puncture 0.5 to 1 cun, apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. Zhigou, Sanjiao 6. On the posterior aspect of the forearm, on the line connecting Yangchi, Sanjiao 4, and the tip of the elbow. 3 cun above Yangchi, Sanjiao 4, between the radius and ulna, Jing river point of the Sanjiao meridian. Indications: soreness and pain in the shoulder, back, and chest, and hypochondria pain, deafness, tinnitus, and constipation. Puncture 0.5 to 1 cun, apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. Jianmiao, Sanjiao 14. On the shoulder, posterior to Jianyu, large intestine 15, in the depression posterior inferior to the acromion when the arm is abducted. Indications: paralysis of the upper arm and frozen shoulder. Puncture 0.3 to 0.